Living at home as you age is a goal that many of us share. We want to be comfortable, at ease. And for many individuals, couples, and families, this outcome is quite possible. All it takes is a little planning and preparation to reduce several risk factors associated with aging in place. But what are those risks? How can a medical alert service help? And when is it time to consider such a service? We have 8 simple questions that can help you determine when a medical alert service may be right for you. Are you alone for several hours of the day or night?
I'm an occupational therapist and I work for a rehab hospital. In my line of work, we do refer patients to Lifeline.
Well, I'm a registered nurse. I've been a registered nurse for 18 years. I'm a professional firefighter. I've been a professional firefighter for 17 years, and I'm also an EMT. Philips Lifeline is the service that I see the most, I recommend the most. You want to live in your home as long as possible. That's the goal of every person as they age. They want to stay in the home that they raised their children in, that they grew up in. Philips Lifeline gives you that ability to stay there longer. It gives you a sense of security.
In the past year, have you fallen or been afraid of falling?
If you do fall, there are a number of consequences: bruising, broken bones, brain injury, and other complications related to those as well. It can create a sense of fear and nervousness to continue on with your normal daily activities, and you're essentially going to lose your independence over time.
Have you been hospitalized or treated in the emergency room in the past year?
When you leave that hospital setting, it's nice to know you have that security when you get home. Philips Lifeline gives you that bridge, gives you that security.
Do you have at least one of the following chronic ailments? Heart disease, stroke, COPD, osteoporosis, diabetes, or arthritis?
Certain medical conditions make you more susceptible to falling, depending on the medications you're on or just the general disease itself and how it affects your function and your independence.
Do you need a cane, walker, wheelchair, stair climber, or other assistance in balancing or walking?
If you need a cane or a walker, your mobility is impaired in some way, whether your balance is affected or your sensation in your feet, and those right there will put you at risk for falling.
Do you take several daily medications?
Senior patients tend to be on a cocktail of medications, which a lot of them interact together, and while they're necessary, they can create other problems such as dizziness, lightheadedness, low blood pressure, that kind of thing, and all of those things together can put a senior at risk for falling.
Do you need assistance dressing, eating, bathing, or using the bathroom?
So if you need assistance in your daily activities, just general things like getting washed, dressed, that kind of thing, chances are your balance is impaired.
Would a medical alert service provide peace of mind for your loved ones?
I think it's a good safety net to have at home.
Philips Lifeline brings a sense of security to family members and also a sense of independence to the patient, family member at home.
Now that you reviewed the questions, it's time to do a little math. Any yes answers are significant and can provide a good platform of conversation between you and your healthcare provider. However, over 3 yes answers suggest that a medical alert service would be helpful and should be considered. And over 6 yes answers indicates that there may be serious risks for you to consider, and a medical alert service could be strongly advised.
I live close, I'm 3 miles away, but the rest of my siblings all live out of state. And I think especially for families where they're a distance away from their parents, it makes a lot of sense to have that conversation and express your concern to your parent about why something like this would be valuable to them and to the family as a whole.
It brings, to me, a lot of peace of mind, and it is not just a question of having children live out of state and a long way away. Philips Lifeline is there because it informs them and it keeps them posted and they know when they should come, to make them feel more secure and to actually, well, in my case, save your life.
Maybe it's time for you to consider a Philips Lifeline medical alert system for you or your loved one. For additional aging in place questions, visit our online living assessment. located at www.onlinelivingassessment.com. To learn more or subscribe to the Lifeline service, please visit our website at www.lifelinesys.com or call us at 1-866-714-5297 today.